So the first bit of housekeeping to let everyone know that we have recorded this. So you can put any comments in the chat or the Q&A anonymously. And we'll try not to read out people's names. And if you want to, we will let you unmute when we're having our discussions. So welcome everybody. It's a real pleasure to do another live webinar. Alpesh and I did a few very long webinars. We had hundreds of people on during the beginning of lockdown, which is now a distant memory. So it's really great to get back and do a live webinar. So just a short introduction. Alpesh and I set up the Embryology and PGT Academy many years ago. We've been running lots of hands-on workshops, and we were asked over many years to deliver some online learning. So I have been Director of Education in our institute for many years, since 1996. And I've taught many embryologists around the world, as has Alpesh. So Alpesh and I have known each other for over 20 years. Alpesh as well has taught many embryologists. And so we set up the academy to originally to deliver hands-on workshops, but about 4 or 5 years ago, we set up the online certificate in clinical embryology. And now obviously online learning has become very popular. So our original platform definitely was a little bit clunky. It was when online learning was relatively new, and there had been some glitches along the way. But I recently did a course, actually a positive psychology course, nothing to do with embryology, and it used a really great purpose-built platform, a commercial platform called Rizuku. And this system works incredibly well. And so we decided that we would move everything over to the new platform. And the greatest thing for me is that we can edit it immediately. So if a new paper comes out, or if I want to speak to any of the delegates, or any other information we want to edit, we can do this incredibly quickly. And I've really enjoyed building it on this new system. It's been very easy for me to build, and hopefully very easy for those to learn from it as well. And it's been an absolute pleasure. Some of you will know Keshav. Keshav has been also very passionate about teaching embryologists the theory and practical information that they need to know. So it was a real great pleasure, and to me, absolutely obvious that the three of us should start working together so we can really help embryologists around the world understand what they need to know, especially the theory, but practical aspects as well. So today we're going to talk a little bit more about our certificate in clinical embryology. So I'm just going to give a short presentation, just a very short, about the certificate, and mainly about module 3. So we want to now do many more live webinars. So at least every so often we'll do a live webinar for different modules. We'll rotate around. And the three of us had a chat about which module we should do first. And we thought the module 3 was in many ways one of the most exciting modules, which will give some embryologists some really new concepts to, well, hopefully all embryologists, some new concepts to learn. But it's something that's really passionate to all three of us. So we thought this would be great to start with module 3, but all of the modules have been rebuilt and they are all open and already have people taking them for the whole certificate. So let me just briefly tell you about the certificate. We have a YouTube channel, the Embryology and PGT Academy, and there are lots of videos there that we've made through the years. And there is a new video we put out last month in May, which is showing you the new platform and how it works. So I'm not going to go through everything that's on that video. It's only, I think, 7 minutes. But before I do, actually, let me just give Alpesh and Keshav the platform just to say hello to you as well. So Alpesh.
Thank you so much, Joyce. Lovely to meet all of you, although virtually. And as Joyce explained, we are both passionate about education. And of course, I've been involved in clinical embryology for quite a few years, almost 27 years now. So I really enjoy teaching. One of the things I always say that has kept me sane doing clinical embryology is the academics that is associated with it. So I often tell Joyce that it's my escape from the clinical arena, is when I'm in my element when I'm teaching, either at University College London or lecturing. So I really enjoy that part of the job that I do. And hence that's what led Joyce and I to kind of establish this online certificate, whereby obviously our speciality and our kind of passion would probably come out in the form of teaching to help as many embryologists around the world to get a certification system under their belt. We know that in many countries, there is no formal certification system when it comes to clinical embryology. And certainly countries like India have also come up with a system whereby they are trying to introduce some basic level of certification for clinical embryologists. So hopefully this certificate will also form part of some framework which will enable the clinical embryologists to empower themselves with the theoretical knowledge that it requires in order to practice clinical embryology with a lot more confidence, which will ultimately benefit your patients and the outcomes of ART. So thanks for those of you who have already enrolled, and we're certainly hoping that with the support of industry and pharma, a lot more of you will get the required funding in order to join the certificate. The beauty about the certificate is that it is a modular program. So you can do it in bite sizes. You don't have to do it all at once. It is aimed at the clinical embryologist, who we know is busy and essentially may not have the time all the time to be studying and doing exams or doing essays. So we've made this very adaptable to the working life of the clinical embryologist. And hence the whole framework of it being modular in terms of video lectures, do the lectures at your time, and of course it's got a lot of flexibility. So I hope you find the platform interactive. As Joyce has said, that we've introduced this certificate on a new platform now called Ruzuku. I certainly have navigated through it and I find it very interactive, and I really think it's so easy to navigate through as well. So I'm certainly enjoying my navigation, and I'm sure all of you who are enrolled for it, with it, will also see the benefit of the platform and of course the certificate as well. Over to Keshav.
Hi everyone, a very good afternoon to all of you who are joining us from UK, a very good evening to all of you who are joining us from India. Again, thank you to Joyce and Alpesh for actually inviting me to be a part of this amazing opportunity. As co-chair of the embryology SIG for Aspire, I think early this year we actually did a small survey which had about like 200 participants from who are embryologists. And one of the biggest things that came out of the survey was the need for training and the need for courses like this and the need for educational webinars. And that's where I really feel that this certificate course is going to help a lot of us, especially in the Asia Pacific region. I know some of you are actually joining us from India as well as this region. And it's being designed so well. Joyce is going to talk about it very soon. And I really hope that you can join and you can learn and you can actually interact with all of us so that we can actually build a nice community and just take our field forward. So Joyce, over to you.
Thank you both very much. That's brilliant. So yes, I think what's important is that I started as a clinical embryologist in 1987, and I didn't understand the theory of what I was doing. Someone taught me how to do the practical, but no one taught me the theory. And it's a bit of a shame that we're sort of 30 odd years on and we still haven't got a lot of this. So, and when Alpesh and I started this certificate, there was really nothing for embryologists. There's a little bit more in the market now. But when you go to a conference, it's all about the new things and the cutting edge and the future and the research that people are doing now. And there's not the basics. So our real aim here is to teach you the basics and from the world leaders in this field, not just from ourselves. So I won't go through the full faculty of all the modules. I'll just go through module 3 in detail here. But on the video we've put recently on YouTube, we've gone through the whole faculty and you can see the world leaders in these areas, and it's brilliant to have them on board. So we decided on 8 modules. the first 4 are really fundamental to the embryologists. And I am really sure you will learn something, even though you may have been doing embryology for 20 years already. You will really learn something in these modules, and hopefully it will make you think a lot more about what you do in the lab. And if you are working in the lab, then there is also an optional logbook for you to log some of the key procedures. And it's not just you've logged 50 egg collections. You'll see the way that we've designed this. We've gone into the nitty-gritty in the lab of what you really need to be considering. And again, I think you'll learn a lot from looking at the logbook. So even if you don't submit it to us, please feel free to download it and maybe take some tips from there. And with all of the modules, there is also an optional exam, a multiple choice exam. We are just trialing a system where we have the exams opened on fixed days. I think it gives it a bit more momentum. If you know there's going to be an exam on the 30th of June, you've got to get ready. It is an online multiple choice exam. How we did it before was that it was always open and you got an individual exam when you were ready to take it. There was a little algorithm that made you an individual exam from a pool of questions, but we're going to try this other way. I'm always wanting to improve how we teach. We always do this on the modules we teach at the university. And so there's also feedback to tell us what you thought about the module. And we'd be really grateful when you finish the module to tell us so we can continuously improve it. So the last 4 modules are slightly to the side of embryology, but I think really important for any embryologist to understand these concepts as well. So we go from new technology to reproductive health. And I think when you go through these modules, you'll see how important these sorts of topics are for you. So I'm just going to briefly talk about module 3, because today is all about genetics, pre-implantation genetic testing and prenatal diagnosis. So this is something I've been teaching for almost 30 years. And we have some of the key players also here. So obviously Darren Griffin started with us right at the beginning and was responsible for the first ever fish cases for sexing embryos. Alpesh, again, we know all what Alpesh has done in this field. And then Georgia is someone you will be aware has published very extensively on embryo biopsy. Alan Handyside needs no introduction. Obviously, the father of PGT developed the first ever cases, and he's giving a lecture on this. So we're very privileged to have Alan on board. And Roy has worked with us at UCL for many, many years and is now with iGenomics. And Roy is coming to be with us for our closing webinar. So we'll do a closing webinar on the 29th of June at the same time at 2 p.m. And Roy will be joined by, but all of us 3 will be joined by Roy and also Dagan Wells. So Dagan, again, has worked on PGD since the early 90s and a great friend of ours. So Roy and Dagan will join us for our closing Q&A. So you're all very welcome to attend that. And then we're going to go on to prenatal diagnosis. So Ageliki did a MSc with us in prenatal genetics and fetal medicine, and is now very involved with non-invasive testing. Sarah works with me in the UCH in the hospital. She works on invasive procedures. Karen is a genetic counsellor who's lectured for many, many years on our MSc. And then I'll discuss some of the ethical concerns and the future work. So this is sort of a very normal representation of the faculty that we have on each of the modules. But now I want to ask you some questions. So when we teach, we never just talk at our students, we always interact with them. So it's very easy for you to do, and you just have to log into this once and then you'll be on. So you go to the web address, it's at the top here, menti.com, and then you put in this long code 81604897, and then you'll be able to answer all the questions that we're going to ask. And they're just so that we can interact with you and hear your sorts of comments. So if you can log on to that, that would be great. That's brilliant. we have some answers already. So this is very interactive. As the answers come up, they'll show immediately. So we have mainly embryologists so far. Anyone else? Got a number of people on board, so it'd be good to hear what your background is.
And you know, this module is designed in such a way that it's actually going to cater to all of us. Like, it's not just for embryologists, it's for doctors, fertility specialists, geneticists. I mean, even nurses can actually enroll and learn about PGT and embryo biopsy. So as we see, we're getting a lot of embryologists who've joined us today, but we can actually cater to everyone here. Right, Joyce?
Absolutely. Thank you so much. Yes, we totally can. And I think some of these modules, as you say, even for nurses, even for nurses, will be really great for them to understand what people do in the lab. I think the first 4 modules are quite heavy for people outside the lab, but the next 4 certainly. Excuse me. Oh, we have a geneticist on board. You're very welcome. Excellent. So we'll move on to the next question, so you can get a flavor of the sorts of people that we're chatting to today. So which country are you working in? So you can just write the country on this one. Welcome. We're very, very international already. United Kingdom, Australia, Denmark. Brilliant. Malaysia.
Wow.
Fantastic. Let's see how Dubai. Welcome. Let's see how global we can get. So when these word clouds, the bigger the word, then more people have written that. Oh, we've got someone said embryologist. Right.
Wow.
Yeah, fabulous. We'll give it a few more minutes.
Indonesia, Malaysia.
Brilliant. I love it. And you can log on anytime. So if you haven't been logging on yet to answer any of these questions, please feel free to keep logging on, and you'll
There's
be
one
able
from Colombia
to...
as well. So he's put it in the chat. I don't think he's on Menti, but there's one from Colombia.
Oh, one from Colombia. Brilliant. Very welcome. So I just want to ask, we've got quite a number of people that have started module 3 now on Rizuku, but there were quite a few of you who registered who hadn't. So I just want to ask you, how many of you have started? Or if you haven't started yet, you can either write no or not registered. And just to say again that when we started the certificate, the platform we were using, because it was sort of home built and it was very expensive to run. And now with these new purpose-built platforms, it's been much cheaper for us. So it's brilliant that with technology, we can sometimes reduce the price. So now the special price we're offering each module at the moment is for just £100 each. And we also had problems with how people could pay for this in the past. We originally started with, goodness me, banker's drafts, which was very time consuming. But now you can put any credit card into Rizuku and pay, and you'll have immediate access. So that's really a great improvement. So I'm just checking the chat. Good. So you can either, if you have any questions for us, you can either write in the chat or in the Q&A. And there is one about biopsy workshops in the Q&A, which I will come back to when we get to biopsy. Good. So welcome. Those 6 of you that have already started, very welcome to you. So have you this is for all of you, have you learnt any genetics before? So while you fill that in, so I was one of the founders of the ESHRA certificate, the clinical embryologists, and we were very aware that people hadn't learnt a lot of genetics then. And I also talk on the STP training course for UK embryologists. And again, I'm also aware that they haven't been taught a lot about genetics. So I think it's really important. So we did start this module quite basic, so that anyone, even if you've never done any genetics before, you can keep up and not get lost. But you all have. So that's brilliant. I'm so glad times have improved. I always say to everyone, all embryologists need to learn genetics. Absolutely. It's really the future and really important. So that's brilliant. So you can only pick one here. So take your time to think about this. Which procedure do you mainly do? So which procedure do you do most of the time? So I was someone that started on embryo biopsy, because when I started on PGT, I was a clinical embryologist. But then I started to do the PGT, and I felt that I'd learnt really the hard way. This is one thing why I'm so passionate about teaching you the theory. I think, well, twice in my career, I have learnt the practical part without really understanding the theory of what I've been doing. And I think that's a very, very difficult way to go forward. So most of you have learned some biopsy, or did you do biopsy? A few of you, one PGT-A, but some of you none, which is absolutely fine. It doesn't matter if you don't do any of these procedures, or if your clinic doesn't do these procedures. I think it's good for embryologists to know about them and to understand what's happening. Now, I'm just going to go to one of the questions in the Q&A. Would love to know information on workshops for biopsy, either in the UK, USA, or in Australia. So Alpesh and I, obviously, I started the first workshop back in 1996, and it was after my dear friend Leander Wilton had invited me to do a biopsy workshop in Australia the year before. And I thought, wow, this is what we need. We need to teach people how to do this. So I brought the idea to the UK in 96, and we used to teach everyone everything. So we used to teach people a bit of FISH, then the fluorescent in situ hybridization technique, and we also taught people a little bit about PCR. So our original workshops, Alpesh will remember, they were 5-day workshops, and we really went into a little bit of everything. But times have changed, and the way the diagnosis is done now is much more complicated. It involves complicated and expensive equipment, and really the lab needs to be an accredited lab, and it's got a lot more high caliber. It's not so easy for somebody who doesn't know about genetics to sort of dabble in. So now I think we really have specific roles. So you're either an embryologist doing the biopsy, or you're a geneticist doing the diagnosis. There are a few people like me that did a little bit of both, but I really felt that I was trying to be the jack of all trades and the expert of none. It's a saying that we have in England, when you do too many different things. So I think it's really important for people to try and specialize. So in answer to the workshops, now, obviously COVID made us stop the workshops, and people are asking a lot about doing workshops. So Keshav, are you doing any in India?
Yeah, so I regularly hold, so I don't do a workshop. What we basically do is that we get candidates whenever they are willing to come, and we hold like 2 days to 1 week courses on embryo biopsy. It's in our clinic, which is located in Agra, and that's pretty much it. So if you feel that you can come to India, you have a convenient date, just shoot me an email and I can schedule something for you. The best part about it is that you are coming to the city of love. You can actually visit the Taj Mahal with it. Get some sightseeing going on around the course as well. So yeah, we're holding courses now, and because the restrictions of COVID are now gone within our country, so you can easily come and visit.
Keshav, Joyce and I can also come and help you teach. So we would love to visit Agra too. So
let's do a workshop here.
But there's a lot of questions about this for sure. Whether Alpesh and I do another one in the UK, I think we've become so busy with other jobs. And to be totally honest, also a lot of the companies now are offering workshops. Our workshops were very non-commercial. We had a number of companies come with biopsy equipment and diagnostic equipment. And so we were very inclusive. So if you go to a company one, you'll just hear about it from their point of view. But yes, there are other workshops around at the moment, so we can discuss this. Another question in the Q&A said, with new laws coming up, how frequently and conveniently can we do these? I assume you mean about traveling, and yeah, that's, I think things are much more open now. But again, if people want to do workshops in specific countries, Alpesh and I have traveled around a lot to do workshops in the past, and maybe this is something that Keshav would be interested in doing. We could run workshops in specific countries at specific times. So if you want,
Joyce, I think so. This question is coming from India, and we have a new law that's coming up within our country, and I think the candidate is trying to ask about that, because now there are new regulations for embryologists within our country, and there are very specific regulations. So, I mean, the best part about this course is that it allows you full freedom, in the sense that you can do it at your own pace. There are 8 modules. You can finish it off all in a month if you feel like it. If you want to go slow, you can do it at your own pace. We would want that you finish it on the given timelines, so that you can attend the opening and closing webinars and have a discussion with all of us. But again, that's not a mandatory requirement. And as far as the law in India is concerned, this would allow you to get a lot of theoretical knowledge. Obviously, practical experience is what is included in the law, which you can get from any clinic, but the theory behind it is something that you can learn from all of us.
Perfect. Okay. If you do the biopsy, which stage are you mainly doing embryo biopsy? Are you doing polar body, cleavage, blastocyst, or I thought I put non-invasive, Alpesh, just to see if anyone's doing non-invasive. So
it's really picking up. I mean, there are so many companies marketing it in India now, and I mean, people don't realize it, that it's just a ranking tool at the moment, and it's not like a diagnostic tool. And I mean, we've had so many debates over it in the country, but I mean, that's something that probably we'll discuss in this, probably in the last closing webinar.
Yeah, but let's talk about it slightly here while we're asking. So Alpesh, do you think we're ready to do non-invasive PGT?
Absolutely not. We're not clinically ready yet to do non-invasive PGT. Although the technology is very promising, and of course the best results or the best validation studies have only shown around 80 to 85% concordance to the traditional methods of sampling blastocyst trophectoderm biopsies. We can't launch a technique for clinical use with around 80% concordance. The other problems that we have currently with non-invasive PGT is the number of false negatives and false positives. And of course, we really need to be alerted, and we need to really be careful about the false negatives per se, because it's one thing that if you're looking at aneuploidies, but it's another thing if you're going to be doing any kind of monogenic disorders, etc. So there's still a lot of work to do, I believe, and I don't believe that this technology is yet ready for clinical use.
Yeah, that's what I thought. And it's interesting that Keshav said there's so many companies offering this. I was on Twitter last week, and I said, you know, it's really the situation in IVF. We have companies that will make a test or a product that before it's even been shown to be of any benefit to anybody. And I'm part of the ESHRA add-ons working group, and we're writing recommendations. And that is really what we found. So many companies jump on the bandwagon when there's no evidence that the technology is working. So here we are with PGT, and there's obviously many examples in PGT, but companies now making the non-invasive testing when, as Alpesh says, there is extensive experience that we're not really ready to do this. But most people.
My biggest concern with this was, especially in a country like ours, where patients don't have that much of an understanding. So, and the doctor also is not really listening, and they just ask. So the company comes and says that this is a genetic test, it replaces PGTA, it's non-invasive, all of those benefits, but it's actually not. I mean, at the moment, if you read the fine print, it's only a ranking tool. and it will not give you, like Alpesh said, the concordance is only 80 to 84%. And that's where, I mean, I really feel that patients would suffer if these tests are actually given without any evidence backing them up.
And I think, Keshav, that companies should be a bit more responsible in not selling this tool as a clinical tool, because it's very wrong to tell a patient or a clinic that this replaces PGTA, because the current gold standard for PGTA, as we know, is a invasive procedure, trophectoderm biopsy. So to kind of, and I think a lot of companies are using the tool of, oh, this is cheaper, so go for it. And you'll get the same result. You know, that's what I really disagree with, because essentially it is not yet validated at the same level. Secondly, yes, it may be cheaper, but that should not be the reason to kind of take the risks associated with PGT.
In India, they're selling it as you don't require a skilled embryologist who would probably do the biopsy. So that's their sell point. And that's, I mean, it's working in the sense that India doesn't have enough embryologists who can do biopsies. They don't have enough setups which have a laser. So, I mean, it's working for the company's advantage, but I mean, it's something which is not great.
And so someone's written in the chat, is it regarding the false positive results, is this the same as you could get with blasters biopsy?
So no, it's different. I mean, the false positive rates with trophectoderm biopsy is very low. One of the bigger debates when it comes to non-invasive PGT has been that the cell-free DNA that is being picked up in the culture media, is it the same? Is it purely from the trophectoderm? Is it from the inner cell mass and the trophectoderm? What is the concordance between the ICM and T? And I appreciate that we will still take time to answer these questions. But what we don't really know at the moment is, or what is really worrying, is the false positives. False negatives to a certain degree, false negatives. False positives you can still live with, because essentially you're not transferring these embryos. Yes, in theory, you might be discarding these healthy embryos, but it's the false negatives that are more of a concern when it comes to any kind of genetic diagnosis and the potential transfer of those embryos. As we know that there is also there's already a lawsuit in action in Australia when it comes to non-invasive PGT-A.
Yeah, exactly. But that's been really useful, and hopefully our audience would have learned something from that. So the next question was, who does your diagnosis? So we've got a whole mix here of different companies that have been involved. Do we have any? Do you want to say anything else about that? I mean, as I said originally, when PGT started, both that I was working at the Hammersmith Hospital where it started, and also at University College, where a lot of all the fish diagnosis started. And I can admit that our initial in-house testing was normally done by students. It was done by PhD students. But this is that was not the right way to do it, but it was such a research and development procedure. But now having dedicated people who really are working in a high level lab, an accredited lab, I think is really the way to go forward. So Alpesh and Keshav, any surprises?
Yeah, I'll just add here. I mean, all of this is going to be covered in the module itself, but whenever you're choosing a company, I think you probably want to know what kind of a platform they're using for the genetic test, whether they're still doing arrays or it's NGS. What's the turnaround time? That's something that's important, because that's going to help you in basically like planning your cycles for your patients. Some companies would want to pool samples and then take it in one go. So all of these different questions you would probably want to ask your service providers, and then only decide upon which one. There are a lot of companies in India as well as outside. You also have opportunities to send the sample outside of India. But again, some important questions would be what I mentioned. Yeah.
And I think probably not the cheapest is not necessarily the best. No, and in my view, it should be an accredited lab. We went through accreditation in our lab over many years. I wrote a paper on lab accreditation for PGT about 10 years ago, and having been through it, it really makes sure that everything is the top quality that it can be within that laboratory. So I think, the very minimum, in my view, would be a lab that's accredited. I think with the big companies that are doing this routinely, you've got less chance of having mistakes. Alpesh already mentioned a law case. I've been involved with many law cases as the expert witness, and they're very hard on normally the fertility clinic will be the one that gets sued if something is wrong. So you don't want to be making a mistake in this, and so who you send your samples to, I think, is really, really important.
I mean, even like things like mosaicism or something, or mosaicism, basically, like what's their cutoff or threshold for diagnosis of mosaicism is something that you would want to think about, because the new guidelines are coming up. PGDIS has come up with a statement on it, and I mean, these are things that you would want to talk to your companies about, and yeah, that's another thing that you might want to think about.
So in the Q&A we did during lockdown, we did one it was a 2-hour webinar on interpreting PGT results to help the embryologists understand the reports from the genetic lab. So for those of you, when you're on the module, that is embedded. I'll show you in a moment, but that webinar is embedded in there. I think it's also still on YouTube. When we do the closing webinar, we'll be with Roy and Dagan, who are both they've got decades and decades of experience of doing the genetic tests and giving the results. And Roy came to speak to our students recently, and he said they've totally changed the way now that iGenomics gives the results. So I think one important aspect we will concentrate on in our closing webinar will be the way that giving the results has changed over the years, and what embryologists need to understand now about giving the results. But I don't know what Alpesh feels, but I think working with a established company is really important.
I agree, Joyce, and I think at least in the UK, we have got some very established rules when it comes to accreditation of genetics labs or genetic diagnosis labs. And I think that really helps because, as per the HFEA guidelines, a lab should have ISO 15189 accreditation if they're going to be doing any kind of genetic analysis. And I think that certainly sets some standards, especially if IVF labs are going to be regulated. There has to be certain amount of regulation passed on the other side as well, because ultimately this is it can be a slippery slope, because essentially they're diagnosing embryos that are potentially going to go back into the patient to create a pregnancy. Now, the relationship between the clinic and the lab is very important. I happen to have changed my lab provider because I just felt that I was getting a very kind of a very factory-like service from one of them. So I moved to a more personalized service, which really helps because I have started a clinic here in London, and of course we're a small clinic. So for me, it was very important to have that personalized service when it comes to, for example, calling them and say, can you please process these samples within the next few days? Because my patient has traveled from abroad and she really wants to have the frozen embryo transfer in the upcoming cycle. So rather than giving me the results in 2 weeks or 3 weeks, can I have it in 5 days so that we can start in the upcoming period? And they will honor that. They will be respectful of that. And that's the level of personalized service. So I'm just giving an example that also that relationship is very important when it comes to the channels of communication between the clinic and the lab.
Brilliant. And so if any of you online now have any questions that you'd like us to put to Dagan and Roy at the closing webinar, please feel free to put those in the chat or the Q&A now, and we can discuss those in the next webinar. So that will be, I think that will be really useful for everyone to hear from Roy and Dagan. So genetic counselling's now become much more important. I know at the beginning none of us had a genetic counsellor in-house, but I just wonder, how many of you have an in-house genetic counsellor? And as I've said, Karen Sage gives a talk in the module to explain to us the importance of a genetic counsellor. And I think it's something that I've realized over the years, that those who don't understand a lot of genetics, maybe even the consultant, and certainly the embryologist, they could lead to some confusion if they don't understand these basics. And I think having a genetic counsellor doing what the job says, being the counsellor for anything involved with the genetic testing is really, really key. So unfortunately, most of you don't. So those that don't, please feel free to put in the chat or the Q&A. If you don't have a counsellor, you don't have an in-house one, but I'm assuming that you do have one outside that all the patients would see. So I've been involved with various recommendations for PGT over the years, but we've always said that the patients do need to see a genetic counsellor if they're having a genetic test. So please feel free to write in the text, whether in the chat or the Q&A, if you have one, or maybe let us know if you don't have a counsellor. But I would really recommend that this is something that we do have the patients have genetic counselling.
Can I just add there, Joyce, that I think I would not be surprised if many people say that they do not have access to a genetics counselor. Now, we know that this is a very specialistic area of training. And even in the West, this has been something that has recently developed to the degree of the skill and the indemnity that is required in order to be doing this level of counseling. So I also want to add that as a clinical embryologist, one of the first things when I started my own clinic was to ensure that as clinical embryologists, we do not take unnecessary medical legal risks when it comes to PGT. So it's very important to have access to a good genetics counselor, because as an embryologist, we should not feel the pressure of assessing the genetics results, especially if we do not have the skill to do it, or interpreting this, the results. Now, if you are an embryologist that does not have the background genetics knowledge, and I don't have the hardcore genetics knowledge, so I chose a lab that can actually take that indemnity from me. So for example, they will tell us which embryo can be transferred and which cannot be transferred. Now, you will be surprised that some of the very big providers of PGT service that are American owned or American led will not give you that answer of whether you can transfer an embryo or not, because they believe that that is something they cannot direct you towards, because it falls in indemnity of the clinic and not necessarily the lab. Because the moment a genetics lab tells you that you can transfer an embryo, they are taking the liability, the medical legal liability for it, and the American companies will not do it. So please, I'm just telling you from my own personal experience, that led me to change the lab that was doing my genetic analysis, because it was very important for me that I do not take the medical legal liability in interpreting the results, especially when their report does not say whether an embryo can be transferred or not. Please don't take it on yourself to interpret these, especially if you do not have the concrete knowledge around it.
That's very useful. And one person in the chat said that they have an in-house one, but the patient can find a different one if they want. So I think that's really useful, because some people might not get on with, I think with counselling, you have to have a good rapport with that counsellor. So yeah, I think it's important. I think it may be something that people haven't thought about, but this is why I wanted to put this as a question, because I think it's really, really important. So I think this might be one of the last questions. What do you think are the main ethical issues, especially regarding PGT? And we're not going into prenatal diagnosis in this webinar today. We don't have time. So we've got so far how to manage mosaics. Now, again, Roy and I were talking about mosaics. So we were one of the first to publish about the high levels of mosaicism. When I started learning the fish procedure back in the 90s, I kept thinking I was doing something wrong, because we had worked on a procedure developed in the Netherlands by Edith Koenen and Joep Gerards. They developed a way of spreading the whole embryo so we could do fish all in one go. And before that time, almost everybody had only looked at the biopsied cell. And then when I looked at the whole embryo, I thought I couldn't do fish because I was seeing so much mosaicism. And so we were the first to report about chaotic embryos back in the early 90s. And when I spoke to the two main cytogeneticists, Maria Zenzis and Ros Angel, they'd published some papers in the 80s about chromosome mosaicism, and they'd been doing karyotyping. And they had got very low numbers of cells to look at, but they had seen there was some mosaicism. And Maria and I, when I was in Canada at one point, said to me that she had seen chaotic embryos with the karyotyping back in the 80s, but she really thought it was an artifact. So she didn't report it. So I was glad that we saw this craziness in these human embryos, but we decided to report it. And really, it's been obviously a major problem in PGT since then, because the cell we remove may not be representative of the rest. So this is great. We will definitely talk about mosaicism when we have Roy and Dagan with us. Roy did tell us that iGenomics have changed the way they're going to report mosaicism now. So I'll leave that to Roy to fill us in. We've got a few comments here about PGT-A. So I think most of you will know that I'm a firm believer in evidence-based medicine, and I have been for decades. And I think we all have to appreciate that the evidence for PGT-A is very conflicting and is very, very complicated. We've got 14 minutes left. I think we could spend hours discussing PGT-A. Unless Keshav and Alpesh want to say anything else, I think that will be a major part of our closing webinar, again with Dagan and Roy. I've had many heated discussions with, especially with Dagan, but with everybody, including many of my close friends, about PGT-A. And I think some of us still differ on our views of, but I know some of us differ on our views of this. So we'll keep that as a hot topic for our closing webinar. Did Alpesh and Keshav, did you want to say anything else?
No,
I think we'll keep that for the closing webinar. But I just love how this slide is evolving, because there's so many issues that are coming up, and we can already see that everyone's really interacting quite well. So I think all of us are in for a good time, especially on the platform, because you can actually discuss a lot of topics on the platform itself on Ruzuku. So you can actually like build up a whole conversation on all of these topics. And I think all of us would also like to pitch in there once you ask these questions.
Yeah. Let me just, so one of the ones here is discarding embryos that may have been able to self-correct. And that's certainly with the mosaicism, there was a certain window where these embryos would have been discarded. But now they're being transferred. So again, I know Roy's got some really good information to tell you about this that he told my students last week. So we'll keep that for the closing. Let me just see, this one is charging patients for testing and they have a bad outcome, e.g. just being told someone had a triploidy miscarriage with a PGT normal embryo. Again, we'll leave that for the closing. It's going to happen. It's a triploidy is a tricky one as well. But let's keep that question for Roy and Dagan to answer in the closing. Sex selection. So obviously when you do PGT-A, all the methods now, you would know the sex of the embryo. Alpesh, I think that we had a discussion last week with Roy with our students, and you all know this better than me because I'm slightly to the side of the clinical work now, but is it true that all the companies dealing with the UK do not tell the IVF lab the sex anymore in the UK?
Absolutely, it's illegal to do so. So genetics labs are not allowed to mention the X and Y chromosomes. They're only allowed to say whether there is an aneuploidy relating to the sex chromosomes, not necessarily the gender of the embryo. So yes, absolutely, it's illegal. Even we do not have sight of that information.
But in India?
In India also it's the same. It's absolutely legal. We have very stringent laws for sex selection. I don't know if you know about it, but our ratio of male to female births was going down quite a bit. And that's where there's this law known as PCP and DT, which came up, which absolutely disallows sex selection and even revealing the sex of the baby via ultrasound or any of the prenatal tests. So it's very, very stringent in India.
Yeah, and so we've got some quite international people here. So in the chat, please feel free to tell us if in your country you can transfer the embryos after sex selection or not. So I know in some countries it is legal. Northern Cyprus, US, it is legal, but not everywhere. So feel free to put that in the chat. So illegal in Australia, yeah. There's a question here that I think it'd be better for us to answer. They've had a patient who's had numerous cycles, had PGT-A, advanced age, all of the blastocysts were aneuploid. What would be the solution or recommendation for the patient as they went through so many IVF cycles? Alpesh or Keshav, what would you?
So maybe I can go first on that. Of course, one thing, IVF and any kind of genetic diagnosis is, it's not just a treatment tool, it's also a diagnostic tool. And depending how much weight you put on the diagnostic element and whether you believe in it or not. But if you do have a patient who's repeatedly shown aneuploid embryos and potentially has a risk of miscarriage, has got a history of miscarriages and implantation failures, you're pretty much funneling into answers as to why that reproductive history is bad for that couple. So I think it helps you move them to the next stage, which potentially could be gamete donation.
Yeah. And someone's written in the Q&A, mosaicism can be overcome by doing blastocyst biopsy. Definitely not. Mosaicism is a biological problem. It absolutely depends what the percentage of mosaic cells are, where they are. You might biopsy some, you might totally miss them and you just get one or the other. So unfortunately, there's no method of biopsy that will overcome mosaicism. And the last question here, rebiopsy. So Alpesh, I know we've been involved with rebiopsying over the years. So what would you do now when the result is non-informative? Do you do rebiopsy?
Absolutely. So we offer this as a option to the couple, because we all know that when you rebiopsy, you can potentially even harm the embryo, to a certain degree. So we often use the analogy or the equation that if there is only one, so for any kind of PGT-M or PGT-SR, we would always advise rebiopsy. We would never take a chance. But if it is a PGT-A, which is for repeated implantation failure, I may advise the couple that, look, is it worth traumatizing the embryo further? Let's put it back undiagnosed.
Yeah.
I wouldn't, if it's for repeated miscarriage, again, I don't think I would take a chance. I would potentially insist on a rebiopsy.
Yeah. Okay. So I just want to show you very quickly, we've only got a few minutes left. I'm just going to show you, hopefully, a little bit about how the module works. It should have been open. Now I see it's not open. Let me just give me 1 second. Technology sometimes fails us. Right, I'm just going to move that over. Oh, there we go. Right, hold on. This is the trouble with using, there it is. There it is. I found it. Right. Here we go. So I just wanted to show you how Rizuku works. So hopefully you can all see the Rizuku now. So this is how it looks. You'll get a welcome to the course once you register, and all the links, because this is so fresh at the moment, the links, we have put it out on various social media, but we haven't updated our embryology certificate website at the moment because that's still done by someone else and they take a bit of time. So I've put all the links to all the modules, where you click to enroll on my website. So I'll share that at the end, but joyceharper.com, if you go on the top tab, it says IVF and PGT Academy. And if you click on that, you'll get all the links of the website, or the Rizuku website, of how to enroll for the modules. So it's very, very simple to enroll, but you'll get your welcome, a little bit about us, and you can introduce yourself to each other. And here it's got about our 2 webinars, which we've got now. And every module starts with an introduction from me. And then, for example, let's have a look at Darren's. So if you click on the top bit, you get the aims of each talk. So the aims of the talk, and then you click on the outline. So you'll get a written outline summarizing the talk. Then you will get the talk itself. So you just click on the arrow and you'll hear the presentation. I can click now. So you'll get the presentation there. Oh, this is me again. And then, yes, with that as well, you will get a question that it's optional whether you want to answer that or not. So I've said, often embryologists have not studied genetics. Did you learn some new concepts in this lecture? And then you will get the references. So there will be some key references here, and then just some other references. These key references, if you click here, you will get straight to the paper. So with the key references, we give you the link so you can access the paper. If you have permission to access it, some of them you may not have permission. Hopefully most are publishing open access. And then there'll be some additional references. And you just click on our logo here to get back. So if the speaker is not myself or Alpesh, then you will also get a bio. So this is George's bio, so that you can know who they are, who are giving the lecture. And then at the very end, when we get to the end of the module, you could do these talks in any order, but they are in a logical order. So here's our webinar that we did during lockdown of the interpretation of PGT results. Here's the logbook. You just click on this and you can download the logbook as a Word file. The exam will be open on the 30th of June, only on that date for 1 day. And there'll be another chance to do a different module 3 exam on a different date. We can sort out all the dates with you and let you know. And then in the conclusion, there is some feedback for you to complete. You just click there. It's a very short 5-minute feedback. And then the next step. So once you've enrolled, under next steps, all the Rizuku links for all the other modules are there so that you can take those modules. So if anyone's got any questions for that now, please feel free to ask. And hopefully,
there's a question which basically asks the ability to sit for the exam from Australia.
Yep, the exam is online. We're doing everything online. So the exam's online. So absolutely, you can do it any way you want. So I'm just giving you the demo. Hold on, I've got to put this back on to present. 1 second. Let me just, it's always hard with Zoom to toggle between screens. Right, present. Right, we're back on present. Right, so now we're just going to finish off now with a Q&A. So in here, you can ask any questions, or you can put them in the chat or the other Q&A. Please feel free. We've got a couple of minutes left. And so if you go to my website, as I said, there's a link at the top called IVF and PGT Academy. It's got all those Rizuku links. And in the next couple of weeks, we'll have updated our other 2 websites with all of that information. And this video will go on YouTube tonight, by this evening. So let's just spend the last few minutes answering any more questions. Yep, you can join the modules at any time. So one thing we've always wanted to do is, we appreciate that embryologists have very busy schedules. So you can take the modules anytime. And once you've registered, you have I think you have at least about 2 years to keep access to them. What we will do is we will do the exams at set times to try and encourage you to finish it. Our students have been taking some of the modules, have sort of let it slip. So to encourage you to keep you engaged, we'll do the exams on set days. And as Keshav said, we're going to do these live webinars and we're going to rotate them in different orders. I was thinking that next month for July, we'll do the cryopreservation. So we'll do some webinars, at least one, maybe two, live webinars for module 2. So I just want to finish out. Has anyone got any more questions?
There's a follow-up to the same question. They meant about the final exam.
Oh, right. So I didn't mention that. So thank you very much for asking. There is a final, what we've called an exit exam for the certificate. And for this, you have to write a 3,000-word essay about one of the laboratory techniques. And you also have to send us videos of you doing certain procedures with you talking to us about how you're doing them. Now, we can't assess competency, so we're not going to assess that, but we just want some collaboration with you to see that you really understand what's happening in the lab. So we'll give you a chance to do that. And yes, so it's fully online. We had originally thought we might go to different countries and do exams there, but we you know, it's 2022. We've got to do everything online. So we've just tweaked it slightly, so it's totally online. And there was one last question. Is it possible that only the analyzed cells are abnormal and the rest of the embryo is normal? Absolutely. Unfortunately, but we will take that up in our closing webinar with our 2 experts. The very final question I will take now is regarding the biopsy on blastocyst stage. Is it all right to biopsy the early blastocyst expansion, grade 2, or further culture first, then biopsy? What about the biopsy of blastocyst with grade CC? So Alpesh, a final question for you.
So yes, we do biopsy all blastocysts because sometimes it's very difficult to ascertain whether an embryo has a very tiny ICM or not. So you may downgrade it from a B- to a C. So we do biopsy them. And certainly if we get euploid embryos from them, then we would also potentially transfer them, because sometimes we know that that may be the only euploid embryo. Now, the first part of the question was asking about the degree of expansion of the embryo. So we make our openings on day 3 in the zona pellucida. And as long as we have herniation, my advice, actually going back, my advice is not to biopsy early blastocysts. Try and get a more cohesive trophectoderm layer, a more proliferative trophectoderm layer before we take a biopsy, rather than just biopsying early blastocysts. They may not survive even the cryopreservation. So I would leave the embryo to expand a bit more, or if you're making the opening on day 3, just let enough trophectoderm herniate out of the opening and then take the biopsy.
Brilliant.
Yeah.
Any closing words, Alpesh?
No, absolutely a pleasure to be part of the webinar, and I really enjoyed it. And of course, many of you will still have quite a few questions, but keep the questions coming, because that's what makes this forum very interactive. There is no set format for these webinars. So as much as we have topics that we'd like to discuss, but rest assured that we will always take your questions to the next one and answer them. Even if it means us getting those answers from our expert panel, which may not be present in the next webinar, but we will get your questions answered. Absolutely loved it today. Thank you so much. And let's keep the interaction going, and certainly let's have more of you join the certificate.
Thank you. And Keshav.
Yeah, so thank you so much first to both of you. It's a great opportunity. And again, to all the participants, it's a great opportunity for all of you as well, because like you noted, the lectures here are fantastic. The faculty is amazing. And I think it's going to give all of us a great opportunity to learn. And I think that's the key in our profession, because once we stop learning, we're going to become redundant. So keep the like education flowing, and all three of us believe in access to education for everyone, and that's what we're trying to bring with this course, and it's at a fantastic price, so hopefully many of you would be able to register for it.
Thank you so much. So thank you all for coming and being so interactive. And on this slide, actually, Keshav, I haven't got your social media. So what's your best social media? It'd be great for people to start following you.
Okay, so my embryology handle is Meta Embryology. I know Facebook stole Meta from me, but I actually put that first. I'm going to put it in the chat if you want to go and access it. And other handles, you can just find me on Facebook with my name, and that's pretty much it. I'm
okay,
also
and we have another one I forgot here is at Embryology 101 on Twitter. We're trying to post more information there for embryologists. So yes, please visit that. And our email is here, ivf.pgd.academy@gmail.com. And if you subscribe to our YouTube channel, then whenever we post a video such as today's one, you will be notified that it's there. And so thank you all for coming. Hope to see some of you on Rizuku on the module 3 or on any of the other modules. And we will be doing the next webinar with Dagan and Roy on the 29th of June. It's a Wednesday again at the same time, 2 p.m. We've got some of your questions now that we will pose to the panel. And if you are on Rizuku for module 3, you'll automatically get the reminders about the webinar. And if you're not on it, then I will be posting, well, all of us will be posting the Eventbrite link so that you can get the link for that for June the 29th. So please register so that we can make sure you've got the right link. So thank you all very much. It's been a real pleasure. And we're only 6 minutes late, so not too bad. But I thought it's important to answer those last questions. So thank you all. And thank you to everyone who's taken part, and obviously to Alpesh and Keshav as well.
Thank you.
And we'll see you soon. Thank you.
Take care. Bye-bye.
Bye, everyone. I'll stop the recording now.